Welcome to today's video. What we're going to cover is going to be a series, and it's going to be a series around plan documents. And when I say plan documents, these are documents that you as a Medicare beneficiary have access to. Either your plan has either mailed them out to you, or maybe you've signed up to get them all electronically. However, you can also just go to their websites. Either you can log into your portal and pull up your specific documents, and most of these are always going to be available publicly. So that's the cool thing about CMS and Medicare and the government when it comes to Medicare. All of these documents that I'm going to show you today can be accessed by the general public. Why is that important? To me, it's important because if you are a caregiver for someone, or if you're a physician or you're a nurse and you're trying to assist someone, but you're not for sure what their coverage looks like, you don't have to necessarily log in somewhere all the time to be able to see what that is. If you have their ID card and you know what plan they're on, you can go out to that plan's website and find some of that information. So in this series, we're going to go over several different plan documents. In particular, we're going to go over the ANOC. And as you can tell from this series already, there's a lot of abbreviations. So don't get nervous about the abbreviations because there are a lot. But ANOC stands for our Annual Notice of Change. Okay, so it stands for Annual Notice of Change, and it's exactly what it is. These documents go out to Medicare beneficiaries right before AEP. And if you don't know what AEP is, I encourage you to go back and look at our very first video in this series that talks about the annual enrollment period. So as a refresher, during AEP, you're going to pick your plan for the following year, or you can stay in the plan that you're in. However, for you to be able to make an informed decision, CMS or Medicare says the plan has to have you out a document referred to as the ANOC, or Annual Notice of Change, by September 30th, October 1st timeframe, so that you can know what's changing in the plan that you have. Okay, and we're going to view an ANOC. We're going to walk through it so you can actually see. So some of the things that may be in there: this year your premium was $5 each month. Next year, your premium is going to be $10. Or maybe your generic drugs was $4 this year, and next year there's no cost at all for those generic drugs. It's just taking what you have right now and letting you know what's going to change the following year. That document is very, very, very important because that is where your starting place is during AEP to decide, if I'm happy with the plan I'm in, is it going to be similar next year, or are there going to be some significant benefit changes where I actually want to change out of this plan and explore something else, okay? So that's going to be your ANOC, or Annual Notice of Change. The next one is going to be your Summary of Benefits, known as an SB is how we abbreviate it. And it's exactly like it sounds. It is a summary of all the benefits that you'll get by being in a Medicare Advantage plan, or a prescription drug plan, or Medicare supplement plan. Whatever the plan is, your summary of benefits, which probably won't get from a Medicare supplement plan, but that's another video, another day. However, this summary of benefits is going to tell you high level, what are your prescription drug costs going to be? High level, if you go to your primary care doctor, what's that visit going to be? So very high level, what benefits are covered. Usually this document may be between 20 and 30 pages long, and it gives you the contact information for the plan, those type things, okay? Whenever you enroll in a plan, you're going to get a copy of your summary of benefits. Again, that can be totally electronic, or you can opt to have it be received by mail. If you are hard of seeing and you have poor vision, you can actually request these documents to be provided to you in large print. So that's another good feature that the government or CMS mandates that plans have available to you. EOC. So EOC stands for Evidence of Coverage. Now this document is going to be a much larger document. It's going to be the Summary of Benefits expanded expand it, okay? So it's going to take all the benefits that you have available. It's going to break it down into different chapters. This document can be every bit of 300 pages depending on what your plan looks like. It's going to tell you how that you can actually reach out to certain vendors that have benefits for your plan, what's excluded, what's covered. So it's just going to go into very detailed information about your benefits, okay? So whenever you enroll, you can expect to get a summary of benefits, and you can expect to get an EOC either via the mail or electronically. And these documents are also available publicly online. The other one is going to be your formulary. So the formulary is literally just a list of covered drugs, okay? So it's going to be a list of all the drugs and the medicines that your plan covers, okay? This is an important list, not just because I'm a pharmacist and I think drugs are very important and medicines are important, but it's very important so that whenever you go to your physician's office, you take this document with you, or you have it referenced in your email or online. Because if he's going to write you a new prescription, wouldn't you want to know if it's covered? Wouldn't you want to know how much it's going to cost? Wouldn't you want to know if it's going to have to require prior authorization when you got to the pharmacy? And if you don't know what prior authorization is, don't worry, that's a video coming as well. But your formulary is going to be a list of the covered drugs and any what we call utilization edits, which means, is there a restriction of some sort on that medication? Are you only allowed to get so many per month? Are you only allowed to get them from certain pharmacies? That's what your formulary document is going to tell you. And then you have your pharmacy directory, and it's just literally what it says. It's a list of pharmacies, okay? So it's going to have all the pharmacies that you can actually go to and pick up your prescription drugs. You may have a plan that has what we call a preferred pharmacy strategy, and that just means using some pharmacies are actually going to give you a lower copay for your drugs than if you went to one that's in the network, but they're not preferred, okay? So all that information has to be in the pharmacy directory. So in this series, this very mini series, and I call it mini, whenever you're talking about the government, CMS, Medicare, all this kind of stuff, things that seem many may not be too many, okay? But we're going to go over all of these documents. I'm going to show you where to find them for some of the major players. We're going to go over a Blue Cross plan. We're going to go over Humana and United. And hopefully you'll get the gist of what that looks like. And just so you can see where you can actually find these things at online. And then we're going to go over how best to use them. When should you use them? What information should you actually be getting from them? So I hope you join us for this series as we go over each one of these in its own separate video. So thank you for joining, and we look forward to seeing you at each one of these series to go over all these plan documents.